This episode of AMSA TV is proudly sponsored by the Australian General Practice Training and AMSA GP² competition. To get promoting general practice, visit amsa.org.au.
Currently, there are a number of universities pushing for the federal government to approve the creation of new medical schools in Australia. This is a problem because the clinical training system is under significant strain. The number of medical schools has increased from 10 in the early 2000s to 20 in 2012. Further increases in the numbers of medical schools or medical students would constitute a significant threat to the quality of medical education in Australia. There are a number of factors that have led to the strain on the system, including rapid increases in student numbers, significant and chronic underfunding of the system, and a lack of robust national workforce planning. These rapid increases in student numbers have led to significant strain in a number of key areas, including teaching, supervision, infrastructure, assessment, and patient contact. Furthermore, the number of international full fee and domestic postgraduate full fee places is controlled by universities without any central regulation. The numbers of medical students in Australia has more than doubled in the past decade, from about 8,000 in 2001 to 16,500 in 2011. The universities that are proposing new medical schools would add additional students to the system. There should be no further increases in the number of medical students, whether associated with new or existing medical schools, until it can be clearly demonstrated that each student will get sufficient clinical teaching. There's currently a funding shortfall of approximately $23,500 each year for every Commonwealth-supported medical student at Australia's medical schools. This funding shortfall represents a serious threat to the quality of medical education. Whenever a new medical school is established, it invariably involves start-up costs and capital expenses. If there is any new funding available for the system, we need to ensure that it's used as efficiently as possible to improve the quality of medical training. Medical workforce planning has failed to keep pace with the increasing numbers of medical graduates. In 2012, there are likely to be students who miss out on the internships needed to complete their training. In 2006, the state governments guaranteed all Commonwealth-supported students an internship. However, that didn't extend to international full fee and domestic full fee students. Beyond internship, there's been insufficient planning to ensure that graduates can proceed through pre-vocational and vocational training places needed to complete their training, and also to fulfil their potential contribution to the Australian healthcare system. It's important that there are no further increases in numbers of medical graduates until national data, such as that provided by Health Workforce 2025, is used to guide a nationally robust planning process. In order to maintain Australia's high-quality medical education system that serves Australia's population health needs, we need to carefully regulate the number of medical students, including international and domestic full-fee students, increase our clinical training capacity, correct the significant underfunding in medical education, and undertake robust national workforce planning processes. Until these challenges can be comprehensively addressed, there should be no further increases in the number of medical students in Australia and no new medical schools.
To find out more, visit us at www.amsa.org.au or contact your local AMSA rep. Thanks for watching this episode of AMSA TV.